Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the subarachnoid hemorrhage. The subarachnoid hemorrhage is the bleeding into the subarachnoid space. And the subarachnoid space is the space between the pia mater and the arachnoid mater. So this is the subarachnoid space here. These are some of the cistern of the subarachnoid space. This is another cistern of subarachnoid space. We have two types of subarachnoid hemorrhage. One is traumatic, any injury to the head, any part. So entry of blood into the subarachnoid space is the subarachnoid hemorrhage. Atraumatic usually happen in the circle of Willis and the contributing artery to the circle of Willis and the branches of circle of Willis. This is the site at the base of the brain around the interpeduncular area of the midbrain here, and just in front of that around it we'll get the atraumatic or the rupture of the berry aneurysm. The blood vessel has abnormal dilatation like berry. These are secular. Aneurysm may be ruptured here, and there may be opening of the aneurysm and blood will go inside the subarachnoid space. Okay, we got two types of subarachnoid hemorrhage. One is traumatic. Traumatic may be venous blood, may be arterial blood, but atraumatic or rupture of the berry aneurysm, this is always arterial blood hemorrhage. Causes of subarachnoid hemorrhage: rupture of secular aneurysm. These are called secular aneurysm, also called the berry aneurysm. Vascular malformation of the blood vessel, especially the wall of the blood vessel may be deficient in collagen, okay, and due to hypertension, tumor inside the brain, and that tumor is vascular and the blood vessel may be opened into the ventricle. From ventricle it will go to the subarachnoid space. Blood dyscrasia like that of leukemia, sickle cell anemia. Risk factors for subarachnoid hemorrhage: polycystic kidney disease. It is found around 20% of the polycystic kidney disease are associated with that of berry aneurysm. So a person has polycystic kidney disease, usually the person is above the age of 40, and around 20% cases this problem is associated with berry aneurysm. Substance abuse like cocaine, amphetamine, okay, that will increase the blood pressure, that may rupture the berry aneurysm. Vasculitis, there is disease of the blood vessel. Collagen disease like Marfan syndrome, Ehlers-Danlos syndrome. Increased intracranial pressure may be due to a tumor, brain tumor, or there may be associated hydrocephalus, blockage in the cerebrospinal fluid passage, and also increased intracranial pressure due to straining at stool. People may have constipation, they may strain too much during defecation, or also in sexual orgasm there will be increased intracranial pressure that may rupture the berry aneurysm. And the berry aneurysm, a traumatic aneurysm rupture, these are usually on the anterior circulation of the brain. Like this is 40%, here it is 4%, here 20%, 34%. Okay. Complication: death from first hemorrhage around 25 to 50%. A lot of people die on their way to the hospital. Around 25 or 30% people may survive subarachnoid hemorrhage but with neurological deficits. Another percentage of people, around 20%, may be without any neurological deficit. but always there is chance of recurrent bleeding, and each recurrent bleeding subarachnoid hemorrhage is more severe. So we are looking at the circle of Willis formed by the basilar artery, that is formed by the vertebral artery, internal carotid artery, 2 branch anterior cerebral artery and the middle cerebral artery, anterior communicating artery connecting the anterior cerebral artery, posterior communicating artery is here connecting the posterior cerebral artery, and the internal carotid artery. Clinical feature: why this happen, especially in atraumatic subarachnoid hemorrhage due to rupture of the saccular aneurysm, there will be sudden excruciating headache known as thunderclap headache, often described as the worst headache of my life. Why this happen? This happens due to sudden leakage of blood into the cerebrospinal fluid of the subarachnoid space, and that blood has with high pressure, and it will irritate the meninges and subarachnoid space. That will lead to excruciating pain as thunderclap, the worst headache of one's lifetime. Nausea, vomiting, unconsciousness. Neurological deficit is also possible depending on the type or extent of hemorrhage. Meningeal irritation, we can test it by Karnik sign and by Brudzinski sign. Diagnosis text: CT scan is the standard. Okay, so CT scan will identify the subarachnoid cistern containing blood, this part. This can be identified by the CT scan. Lumbar puncture is another way. Lumbar puncture will get the RBC in the cerebrospinal fluid, and cerebral angiography for a stable patient is the gold standard to identify the Berry aneurysm, or maybe in the posterior aspect we'll get the fusiform aneurysm due to atherosclerotic changes. Okay. Treatment should be done in an emergency hospital with all modern equipment and certainly by the licensed physicians. Immediate neurological consultation with a neurosurgeon. Nimodipine, this is a calcium channel blocker that will prevent vasospasm. Dexamethasone, that will prevent the edema, the brain. And management of hypertension, if there is hypertension, then it should be managed by that of the levitalol or ismolol. Management of hypotension, if this is the condition, then we may use the dobutamine, dopamine or epinephrine. Hyperventilation, that also maintains it also prevents the vasoconstriction as well as the vasospasm. Phenytoin will prevent the convulsion or seizure, and it is wise to elevate the head if there is no problem in the spine. Okay, and that's all about the subarachnoid hemorrhage. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me, and have a nice day. Bye now.